us. I yield time now to Dr. John Fleming.
Great. I thank the gentleman from Georgia. I wanted to cone down on the debate a little bit more. Again, we heard the 30-something groups, Democrats, talking about the debate earlier, and one said something very interesting, really caught my ear. He said that the debate is basically Democrats want health care reform, Republicans do not want health care reform. Now, I have spoken on this floor, as you know, Dr. Gingrey, and Dr. Rowe as well, and I've heard you speak many times. Many members of our conference have spoken. I've spoken a number of times throughout the district. I've listened to everyone from Speaker Gingrich to many others. I've yet to hear one Republican say that he is against health care reform. So I want to remind my colleagues on the other side of the aisle that the only way we're ever going to solve our health care problems, which makes up about 20% of our economy, we must have an honest debate. And framing the other side into a position that really doesn't exist is not going to get us there. In fact, I would say that we really agree, from what I can understand, on 90% of the discussion. We all agree that we should do away with pre-existing illness. We all agree that we should have portability. We all agree there should be 100% access to care. We all agree that we should lower the cost of care. I mean, I can draw you a great list. There's really, when you get down to it, only one thing we disagree with, and that is we feel that a private system, private industry, even if it's paid for by the federal government in many cases, does a much better job in terms of quality of care and customer service, and a much better job of controlling cost. This is proven time after time. Compare our economy with a socialistic economy, and you see every time that we provide much better products and services at a much better price than those countries do. So really, the only disagreement is who is actually controlling the care. And of course, I submit to you that a government-run system is a real problem, and I'll tell you where I learned this. When I was in the Navy as a physician, I noticed in the first year that the commanding officer of the hospital sent out a call and said, this is budget time of the year, and if there's anything that you think we could ever want in this hospital, wink, wink, meaning think of something, dream of things, put it on a list, because if we don't preserve that budget the way it is, then our budget will be cut next year. And that, my friends, is the way government works. If you don't force it in the budget, if you don't jealously make sure and protect your territory, it won't be there next year. Somebody will cut into it. And that's really the way government works. And I'll give you an example, a real-life example of how we will never be able to get rid of waste, fraud, and abuse from our health care system if it's run by the government. Think about this. We have to throw out a wide net, which is very expensive. We may capture a few offenders out there. Because it would have to be a criminal act, we would have to prove that they really did it on purpose. And then at the end of the day, we would have to prosecute them with a lot of dollars. And then we may get one person and we may get a few dollars. That's the way you get rid of fraud and abuse in a government system. In a private system, much different. You have a physician or some other provider in a healthcare organization that's privately run, and if his practices are not the best practices, and if he's not practicing in a cost-effective way, that shows up on a graph. And then, of course, you go to that provider and you re-educate, and you have him work with colleagues, and you get him back to the protocols. And if that doesn't work, then you fire him. Easy problem to solve. It doesn't require all of that. There's no crime involved, and so you can work in the most effective way possible.
Well, reclaiming my time, I think that the gentleman has certainly hit the nail right on the head in regard to this, and we could go back to what